The Discharge to Assess service is Kirklees' commitment to ensure that people who no longer require care or treatment in hospital are supported home as soon as possible. We know that where, for example, someone is very unwell or they've had surgery, a hospital setting is the best place for them. But what we also know is that when people don't require that stay in hospital, when they're ready for their discharge, previously and historically there's been delays.
There's a risk for patients being in hospital from an infection control perspective. People do recover better at home, and if we can provide that support, whether it's in their own home or if they're going back to a residential setting, it's vital that we can be able to provide that.
There may be some people who are more complex and their journey can't be home, and so the Discharge to Assess process would look at trying to find a speedy transition into a care home to support their ongoing and longer term care needs.
Over the past 5 years, my dad's had trouble with his mobility. It's been declining, and it's been a bit of a cycle of him going into hospital and then I'm discharging him, he'll fall again, go into hospital and then discharge him. The last time he got taken into hospital, he got referred to Morelands Grange and is now in a Discharge to Assess bed, which is where he's going to be assessed to see where his journey should go next. He's a lot happier, he's got service users that he can talk to, he's happy talking with the staff, and he enjoys playing dominoes, and I can just see a big difference in his whole mood.
We have teams within the hospitals working in partnership with the Acute Trust, with social care and with providers to support patients transfer the care from hospital to home, so when they no longer need to be in hospital, we work together to get them home as quickly as we can so they are getting into the right setting.
Caremark is a domiciliary care provider based here in Huddersfield. We are the sort of more long-term care provider that come in after the end of that short-term care package. We do our own assessments, which is very important because the needs of the individual can change quite rapidly after coming out of hospital. We will do our own person-centred care assessment and then do regular reviews of the care plan after that to make sure that the needs of the individual are being met. And sometimes we have clients that actually say, we don't need any care anymore, we can look after ourselves now. And that is an ideal outcome. Yes, we're there to support them as much as possible, but if we can support them to live a more independent life and get better, then that's fantastic. Discharge to Assess is one of those things where a single organisation can't address the issue. So the council is a key player. We've got Calderdale and Huddersfield NHS Trust, we've got Mid Yorkshire NHS Trust, and we also have services such as Locala Community Health Services. It's a wide partnership that's come together, putting the person in the middle of all of this and then thinking about what's the most seamless journey that the individual can be supported with.
This Discharge to Assess bed is the best thing that's happened for my dad over the past 5 years. Him coming here has been a blessing. They're looking after him so well here, and I'm just so happy that he's okay and I don't have to worry about him falling, and if he did fall I know that there'd be somebody there straight away, so it has took a big weight off my shoulders.
The Discharge to Assess service, I think it's been a great benefit to Kirklees and the residents within Kirklees. It's allowed us to really work with the service user to determine what their needs are and how we can meet those jointly. I think moving forward we can only improve it further and really look at becoming more integrated and really making the best use of our colleagues' time to support all the individuals in Kirklees.